This video is a comprehensive guide to neonatal reflexes for pediatric nursing, prepared by Mr. Nagesh Sir. Neonatal reflexes are involuntary muscle responses to specific sensory stimulation. They indicate the integrity of the central nervous system and aid in survival, such as feeding and protection. Reflexes are classified into primitive, protective, and postural types. Primitive reflexes disappear as the brain matures, while protective reflexes usually persist for life. Postural reflexes appear later and help with balance. The Moro or startle reflex is stimulated by a sudden noise or dropping the head back. It involves two phases: arms abduct, followed by adduction in an embrace. It appears at birth and disappears between 3 and 6 months. An asymmetric Moro reflex, where one arm moves, is a classic sign of a fractured clavicle or Erb's palsy. Absent bilateral Moro suggests severe CNS depression. Persistence beyond 6 months may indicate cerebral palsy. The rooting reflex is stimulated by stroking the cheek. The baby turns the head toward the stimulus and opens its mouth to find the nipple. It is present at birth and disappears between 3 and 4 months. The sucking reflex is stimulated by touching the roof of the mouth. It results in strong, rhythmic sucking. It starts at 32 weeks gestation, is fully developed at 36 weeks, and becomes voluntary around 10 to 12 months. The tonic neck reflex, or fencing position, occurs when the head is turned to one side while supine. The limbs on the face side extend, and the limbs on the occiput side flex. It disappears between 5 and 7 months. The palmar grasp reflex is elicited by placing an object in the palm, causing the fingers to curl tightly. It is present at birth and disappears between 5 and 6 months, preparing the hand for voluntary grasping. The plantar grasp reflex is stimulated by touching the sole of the foot, causing the toes to curl downwards. It must disappear before the baby can stand or walk comfortably. It disappears between 9 and 12 months. The Babinski reflex is stimulated by stroking the lateral sole of the foot. A positive response in an infant is dorsiflexion of the big toe and fanning of the others. It disappears around 1 year, but is pathological in adults. The stepping or dancing reflex occurs when the infant is held upright, with feet touching a flat surface, leading to walking motions. It appears at birth and disappears between 2 and 4 months. The Gallant reflex, or truncal incurvation, is stimulated by stroking one side of the spine. The pelvis flexes toward the stimulated side. It helps with birth and disappears between 4 and 6 months. Other primitive reflexes include the glabellar tap, which causes blinking, and the snout reflex, which causes pouting of the lips when tapped. The snout reflex disappears by 3 to 4 months. The parachute reflex is a protective postural reflex stimulated by sudden forward rotation. The arms extend to break the fall. Importantly, it appears later, between 6 and 9 months, and persists for life. The Landau reflex is stimulated by suspending the baby prone. The baby lifts its head, arches its back, and extends its legs, forming an airplane position. It appears at 3 months and disappears between 12 and 24 months. Permanent reflexes persist for life, including the blink, corneal, gag, cough, sneeze, swallowing, and yawn reflexes. They serve essential protective functions. Red flags in assessment include asymmetry, which suggests nerve palsy or fracture. Absent reflexes suggest severe CNS depression, and persistence beyond the normal age suggests failure of cortical inhibition, such as in cerebral palsy. Now let's review some key concepts in a quick-fire round to test your memory. The Moro reflex is also known as the embrace reflex. The asymmetric Moro reflex is commonly absent in a clavicle fracture. A positive Babinski sign is normal until about 1 year of age. The fencing position refers to the asymmetric tonic neck reflex. The rooting reflex helps a newborn find the breast. Next, let's challenge ourselves with previous year exam questions. The Moro reflex usually disappears by the age of 3 to 6 months. The rooting reflex is elicited by stroking the cheek of the neonate. The observation of the arm and leg extending on the face side and flexing on the occiput side is documented as the tonic neck reflex. In a 6-month-old infant, a positive Babinski sign is interpreted as a normal finding due to immature myelination. The palmar grasp reflex typically disappears by 5 to 6 months. Persistence of primitive reflexes beyond the normal age is suggestive of cerebral palsy. The parachute reflex appears later in infancy, typically between 6 and 9 months. The stepping reflex is not a permanent reflex, as it disappears by 2 to 4 months. This chart summarizes the typical age of disappearance for major neonatal reflexes. Remember the mnemonic SRMPTB for the order of disappearance. Key pathologies include asymmetric Moro for clavicle fracture and persistent reflexes for cerebral palsy. Neonatal reflexes are critical indicators of neurological health. Knowledge of the age of disappearance is essential for pediatric nurses. Good luck with your exams. Remember that hard work beats talent when talent doesn't work hard. Thank you for watching this video. For more information, please contact Mr. Nagesh, sir.